Hey Jackie, so today we're going to talk about a little bit of a habit that you were sharing with me. Do you mind sharing what that habit is?
Sure. So I smoke about 2 times a week.
Okay.
Just when I'm stressed. So
Okay.
when it's just like I need to take the edge off. So
Gotcha.
about 2 times a week.
Okay, so what do you smoke in particular?
I do Marlboro.
Okay.
Ultra.
Okay.
Yeah.
Now, how long have you been doing that to kind of relieve your stress?
A few years.
2 years? Okay.
Yeah.
Is there a certain time throughout the day that you like to do it? Or
When I get home from work.
Okay.
Usually, I just get home from work and it's kind of like a de-stressor.
Okay.
Yeah.
Is it something that you feel like you need to do it, or it's just something to kind of get your mind off of the stress?
It's kind of a habit.
A habit?
Yeah.
Okay. And with that habit, do you find yourself wanting to do more? Have you started to become intolerant to it, that you need a little bit more than just smoking that?
Yeah, kind of. Well,
Okay.
yeah. So it doesn't really take the edge off anymore.
Gotcha. Okay. And with that smoking habit, do you find yourself using other things as well, or just particularly the Marlboros that you use?
Just the Marlboros.
Okay.
Yeah.
Perfect. So I really want to be able to kind of help you alleviate that stress habit that you have,
Yeah.
and maybe find some different alternatives.
Okay, good.
The most important thing that I want you to know is that there's great risk factors, not only orally, but overall your health with smoking.
Great.
So with smoking, clinically, it might not be able to show that there's a lot of bleeding, but smoking can really suppress your inflammation system.
Okay.
And with that, that can show critical signs of you possibly having bone loss. You can have gingivitis, periodontal disease, and then you can also really affect your body, your respiratory system, your cardiovascular system, and how to really age yourself.
Great.
With every cigarette that you smoke, you lose 7 minutes off your life. So imagine 2 times a week, you're losing 14 minutes of your life.
Yeah.
So what I wanted to show you is this really important diagram right here.
Okay.
The first one talks about the effects of actually smoking.
Okay.
So some of the effects I want to discuss is better vision and better teeth, and the heart rate can actually drop.
Okay.
With your breathing, you can actually have a hard time to breathe. Your heart rate can actually increase. Your blood pressure can increase as well.
Okay.
Orally, your bone tissues can significantly decrease if you continue your smoking.
Okay.
Like I said, it suppresses your inflammation, so you won't have any bleeding or anything like that, but your oral status will be very weak.
Okay.
Now, what I would like you to think about, is there anything else that you sometimes like to do in moments of stress?
Probably wine.
Wine? Okay.
Yeah.
Any running? Do you do any workouts or anything like that?
Yeah, I go to Pure Bar.
Okay.
Yeah.
So maybe finding that time after work, instead of smoking, going straight to Pure Bar and doing a Pure Bar class, and then maybe getting a glass of wine after, but also you want to make sure that wine doesn't become an addiction where you want to continue to use the wine club as well.
Right.
Because we're trying to sustain that habit from smoking, but we don't want to create a new habit of drinking.
Okay.
So physical activity is absolutely great. When you're kind of just so in tune of doing something all the time, you kind of need to give your brain a breather.
Okay.
So on that drive home, think about getting your workout clothes, going for a walk, and just kind of relaxing yourself.
Okay.
So with doing all of these, different changes to your habit, you're going to ask yourself, okay, so what are the great important things to do it?
Okay.
So on the back of this, here's all the benefits. You'll have better vision and brighter teeth. You'll significantly improve your breathing, which is the most important thing for us to survive, right?
Right.
Strong muscles, lower risk for bone fractures, which again, we talked about having that bone loss in your mouth. Also, faster healing time. So, if you were to smoke and let's say we did a deep cleaning on you, that healing time would significantly increase if you were to continue your habit, whereas if we stopped the smoking in a whole, then that would be perfect, even though your healing would be completely in a flash, right?
Okay.
Lower risk of cancer, of course. You had said that you have thyroid cancer in 2019, so we don't want to,
inflame that.
Absolutely inflame that. And then also heart disease risk will drastically decrease as well.
Okay.
So I gave a handout for you. I would love for you to look at it.
Yeah.
Do you think smoking would be something that you'd be interested to just stop and find those different?
Oh, definitely.
Perfect.
Absolutely.
Awesome. So I think we're going to write some goals for you.
Okay.
Is a great goal maybe the times that you head home and those 2 times a week that you want to,
Yeah.
when you have that inclination, just going for a walk or sign up for that pure barre class, right?
Okay. Yeah.
Make it worthwhile and, make yourself accounted for that, hey, I'm going to work out.
Gotcha.
And then also, too, after you create that habit, maybe the second habit that you can do is just kind of really digging deep and maybe writing a journal on those times of what, is making you stressed, and maybe actually approaching those stresses, right? Sometimes we just kind of alleviate them to the side and just find something quick right now to fix it.
Yeah.
Maybe just finding what stresses you.
Okay. Very cool.
Yeah, so we'll do those goals.
Okay.
And I'm looking forward to see how you progress. What we'll do is at your next 3-care appointment in 6 months, we'll be able to kind of see where you are with your habit. I definitely would like to call you within probably a month from now just to see how you're doing. I'm a call or text away if you have any questions or anything.
Okay.
And I definitely want to be able to have you stop this poor habit and just create better habits instead.
And save money.
Yeah, absolutely.
Awesome.
Thank you so much, Jackie.
Thank you, Stephanie.